Good evening, all. We'll today discuss torsion of ovarian, ovary torsons. Okay, torsions of ovary. Okay, what is that? This is a very important statement. This is a gynecological emergency torsion ovary. Okay, basically this torsion of ovary usually this is most commonly seen in the reproductive age group, reproductive women, reproductive age group women. The ovarian cyst, what is the most common? That is the cyst, that is mucinous, because wherever the content of the cyst is heavy, that is mucinous is totally sticky, it is called as a heaviness, mucinous cyst adenoma. Okay, mucinous cyst adenomas. And another thing, you can see the dormant cyst, that is a totally hair filled with the dental bones, dormant cyst. These two most common cysts that will cause highest risk of, these two are cause highest risk for torsons. Okay, then adnexal mass, any mass, adnexal mass, the size more than 6 centimeters also had highest risk of torsons. Okay, what are symptoms? You can see the symptoms. Usually they present with a sharp lower abdominal pain, and it is localized to the involved side with radiation to what happened. Usually it is sharp lower abdominal pain that is localized to the involved side, and it is radiated to the flank, groin, thigh. Okay, it causes nausea, vomitings. Okay, commonly if there will be adnexal necrosis. Okay, if it is adnexal necrosis will happen, adnexal necrosis may, then that will cause low grade fever. Okay, what is the pathophysiology? Pathophysiology behind the ovarian torsons. I'll tell very simple. What happened during torsons? The what happened? The low pressure veins are initially, if it is, what happened, because it is a low pressure, so it is usually initially compressed by the twisting pedicle. Okay, that will lead to continuous inflow. Okay, that will lead to continuous inflow with decreased outflow, causing stromal edema and congestions. Pathophysiologist is telling, during torsons, the low pressure veins are initially compressed by the twisted pedicle. The twisted pedicle, the ligament, ovarian ligament or round ligament, whatever, or IP ligament, the twisted pedicle will compress initially the low pressure veins, because it is low pressure, so it will easily compressed by the twisted pedicle. That will leads to, but here the initial stage, the venous flow is compromised, but arterial flow is there, so there will be continuous arterial inflow to the ovary. Okay, or cyst. But there will be, because venous channel is the outflow tract, that will cause decreased outflow because of compressions by the twisted pedicle into the low pressure vein. That will what happen, if it is continuous flow is coming to a one ovarian cyst, there will be a stroma, ovarian stroma got edema, that will got congestion of the stromal surface. This will cause the increased stromal swelling, later compress the, then gradually the stromal edema and congestion will cause compression of the artery, that will cause an ischemia and necrosis. Okay, very I will describe in a stepwise manner like flowchart. First, what happened, the low pressure veins, are initially compressed by the twisted pedicles. That this leads to what happens, the low pressure vein get compressed by the twisted pedicles, that leads to, but here artery is intact, so there will be a continuous inflow. You can very easily remember the artery is live. Now arterial flow is there, so venous flow got, venous channel is compressed, that is compressed, so venous outflow is compromised. Okay, so inflow is continuous, arterial inflow will be there present, but venous outflow is not working. Okay, so what happened, there will be continuous inflow, that will cause stromal edema, and second point is congestions. Okay, stromal edema and congestion will happen. Then after, again this stromal edema continuously increasing, the increasing stromal edema later compressing the arterial flow, that will cause now the arterial flow will cause ischemia, that lead to necrosis. Okay, this is the pathophysiology. Then what are the ultrasound finding? I will show this in this image. You can see this is uterus, this is your uterus, this is your uterus, this is the ovary. Here you can see the typical Whirlpool sign, ultrasound image showing Whirlpool sign. What happened, the ovary here in ultrasound, the ovary appears enlarged, it is globular and has a heterogeneous appearance compared to the contralateral ovary. Due to why it is appear heterogeneous, because first thing, why it is appear heterogeneous, because of stromal edema, because of edema, enlargement of ovary, because of congestion and hemorrhage. Okay, heterogeneous lesions in the nexa. Then you have to see the twisted pedicle. The twisting of the vascular pedicle may give rise to Whirlpool sign. The twisting of vascular pedicle give rise to Whirlpool sign. Okay, what is this Whirlpool sign? There will be a round hyperechoic structure. This is you can see this is the hyperechoic, round hyperechoic structure with concentric hypoechoic strip. You can see there will be a concentric hypoechoic strip surrounding it, with concentric hypoechoic strips surrounding it. Okay, the color Doppler sonography should be performed in suspected torsion, as it may disruption. It may show disruption blood flow. So we have to do a color Doppler to see the vascular pedicles, whether it is the disruption of flow is there or not, which is highly suggestive of torsions. However, some case what happen, in some cases there will be incomplete torsions. Okay, or it will be a chronic torsions. In that case you may not show, because it is a incomplete chronic torsion, there will be a compensatory mechanism will be there, so there will be no, you can't show any decrease in flow on Doppler finding. So what we'll do in that case, if you get some cases you get incomplete, in some cases you will get incomplete torsion or chronic torsion, may not show any may not show decrease in flow in Doppler. In that case you can go for MRI or CT imaging to be used. In patient with normal Doppler, this MRI CTs should be preserved. Those patients you will get a normal Doppler. If you get normal Doppler finding but clinically, but with clinical signs and symptoms of torsion, but you are suspecting it is a torsion because you have a clinical signs and symptoms suggestive of torsion. So to confirm and rule out this diagnosis, you have to do MRI or CT imaging. Okay, very very important. So next, how you will management, you have to do if you get a ovarian torsion, urgent laparotomy, or you can go for a laparoscopic evaluations. Okay, how what will do, salvage of the involved adnexa, with the, you have to salvage the other adnexa with the removal of associated cyst or tumor, and possibly our goal should be oophoropexy. If there will be a, if it is salvageable, then you go for a salvageable procedure. Only you have to remove the cyst and tumor, and if it is a long pedicle, you should go for a oophoropexy. Okay, so in a okay, urgent, you have to go for a urgent laparotomy, laparoscopy evaluation, salvation of the involved adnexa. If it is salvageable, then you go for a salvageable therapy, only remove the cyst and tumor. Then after, if it is long pedicle, you go for a oophoropexy. If there will be a necrosis, already the necrosis is there, if it is necrosed of this adnexa, then you have to do oophorectomy. Okay, so I will recap everything quickly. Okay, what is torsions? Torsion is the gynecological emergency. Torsion is a gynecological emergency most commonly seen in the reproductive age group. The cyst, that motionous cyst adenoma or dermate cyst, because of heaviness, the highest risk of torsions. Adnexal mass more than 6 cm, more highest risk of torsion. Symptoms like sharp lower abdominal pain localized to the involved side, then with radiation to the groin, flank, thigh. The symptoms usually nausea and vomiting. You can get if adnexal necrosis is there, there will be low grade fever. What is the pathophysiology? The low precious veins are initially compressed by the twisted pedicles, then continuous that will then but here the arterial part is intact, so continuous arterial flow is there, the inflow is present, but venous outflow tract is blockage, that will not working. So stromal congestion and edema will happen. Gradually this stromal congestion and edema will increase, that will, now the compression of the arterial flow is started. Okay, now ischemia will happen. Then necrosis will occur, that will cause low grade fever. Then how will diagnose? Ultrasound imaging we have to do. Whirlpool sign is the characteristic of the ovarian torsion. You will get a heterogeneous because mass, because of edema, enlargement and hemorrhage. Twisting of the vascular pedicles give rise to Whirlpool sign. The round hyperechoic structure with concentric hypoechoic strips seen. Some case you get incomplete torsions or chronic torsion may not have a decreased color flow, that will get a normal flow. In that cases, if you are suspecting clinical features of sign symptom torsion but you are not normal Doppler finding, then you have go for a MRI and CT imaging. Adnexal necrosis, if there, low grade fever will happen. The treatment management option, you have a go for a laparoscopy based on the patient's stability. If you go for what, if based on the intra finding, if it is a salvageable ovary, then you salvage that adnexa. only remove the cyst and tumor. If it is not able to salvageable, then it is already necros, then gangrene, then oophorectomy has to be done. The goals after salvageable therapy, if it is long pedicle, then goal to be done to be oophorectomy. Thank you. Please subscribe my channel.